Hello and welcome to my channel. I'm Colleen. I am the owner-operator of Serene Primary Care, a direct patient care clinic located in Bellevue, Washington. Today we're going to be talking about hot flashes, why they occur, and what we can do about that. So if that sounds interesting to you, stay tuned. All right, so let's first talk about hot flashes, when women typically start to experience them. Usually it's in our 40s when we start to experience some hot flashes, but they can start as young as late 30s for some women, and they don't necessarily know why they're occurring, and they might think that there's something else happening. But when those hot flashes come on, they really start to see some changes overall in their health, in the way that their body works, and that is part of our menopause transition. So there's a lot of theories about why all of a sudden when we start transitioning into menopause, we start to have temperature dysregulations. So it can be those night sweats where you're waking up in a puddle of sweat after you're sleeping, or it can be the hot flashes where you suddenly get very warm and sweaty and maybe flush. They think that as estrogen receptors are located throughout the body, that will include the area in your brain that is in control of managing your temperature. And when we lose our estrogen, or our estrogen starts to wane and we have less of it available, it changes the way that our body responds, because it confuses that thermostat, and all of a sudden the thermostat is thinking, I'm too hot, so I'm going to sweat like crazy, and then I get too cold, and you just feel miserable. So this is not an uncommon symptom, and many women will experience it. Now, there are many different ways to treat the hot flashes and the night sweats. I will say that the most effective way and the safest way for most women is to treat your hot flashes with an transdermal estrogen. So transdermal simply means that the estrogen is delivered through your skin, and that is usually with a patch. Now, this is assuming that it's been 12 months since your last menstrual cycle that we would use that. So if you are before that, you're still having menstrual cycles, then we may use like a birth control pill, or we might even use the birth control patch, although that's not typically used in older women. So usually you're going to be getting more hormone replacement, which is often with our birth control, to help with those night sweats and hot flashes. Now, not every woman is going to be a good candidate for estrogen. And the estrogen, while it works very well, it does have risks associated with it. So you definitely need to speak with your provider about the use of estrogen, and be very forthcoming about your family history, about your personal history, to determine whether or not an estrogen is an appropriate use for you to deal with your hot flashes and night sweats. There are other ways to deal with your hot flashes and your night sweats. Now, the Menopause Society put out their best practices regarding this, and a few things popped out for me that made me think that is a great idea, and I've tried it with some of my patients and they have had great success. So if you're not an estrogen candidate, we'll sometimes use a medication called venlafaxine, which is also known as Effexor. Remember, this is happening because of the thermostat in our brain. So the serotonin, the norepinephrine that the venlafaxine helps us hold on to sometimes will help with your hot flashes or your night sweats. So that's an option for women who can't use estrogen or don't want to use estrogen. Another option is oxybutynin. So oxybutynin is a medication that we use for leaky bladders, or if you ever have had the cough or the sneeze and you leak a little urine. It's a medication that we use to kind of hold on to urine a little bit better. And it also works for women with those hot flashes and night sweats. So there are some lifestyle changes that are very beneficial. Everyone, you hear this from everyone, and it can feel very accusatory or shaming. We do know that women who do not have as much fat on their bodies will actually have fewer hot flashes and night sweats. has to do with the fact that estrogen tends to store itself in our fat cells. So we know that exercise is beneficial for you long term, but there actually isn't any connection between estrogen and lowering your vascular symptoms of menopause. So even though we know it's good for you in the long run, for your heart, for your brain, it's not necessarily going to change your hot flashes and your night sweats. Some other things that have been used are some supplements, and unfortunately for the majority of supplements, there's not enough data to really say yes or no. So it would be something to talk about with your provider to find out if it's a good fit for you. So I hope that this gives you an idea of kind of what we're looking at when we're talking about estrogen, specifically related to hot flashes and night sweats. My take-home message really is there are options, both estrogen and without estrogen, things that we can do to help with your symptoms. You should not be suffering. And if you are, please reach out for help. Now, I have a clinic and website, and I'm going to give you that information down in the show notes so that you can reach out to me specifically, or you can put a message on the YouTube comments, and I will respond there as well. So I hope everyone is having a great day, and I'll see you next time.